lot of these new faces. We all know health care and Medicare is very important to all of us. So we're very fortunate today to have with us Irene O'Donnell. She's actually our regional Shine counselor, who is actually stationed and works out of Mystic Valley Elder Services, and we all know what a great organization that is. And before we start, the gentleman in the back in the yellow shirt, that's Jeff Beavis, who is our own North Reading Shine Council, who will be available later to set up appointments, maybe ask some quick questions. And we're filming today, so we just ask if you have any electronic equipment or anything to shut it off, because we're filming today, so we get it up on cable for people. So, are we all set there, Mr. Rob? All righty, Irene, thank you.
Okay, thank you, Mary. Can everybody hear me? I usually speak loudly enough. Okay, thank you. Thanks for inviting me here today. It's so nice out. I said to Mary, we should meet outside. So maybe next year we'll plan it that way, a little bit better. A little probably then snow. So we'll go from there. Let me just tell you a little bit about the Shine program. The Shine program is under the auspices of Medicare. It was started over 20 years ago. Actually, Massachusetts was one of the pilot states for the Shine program. It's called Shine in Massachusetts and in Florida, and you'll hear it called SHIP, S-H-I-P, anywhere else in the country. What we're here to do is to provide you with independent, unbiased information on Medicare, on Medicaid, any of the insurances that are associated with Medicare. As you all probably know, or you will know shortly, the Medicare system is a little bit of a maze. I think of the news story that came out a couple of weeks ago about that young family that was in Danvers in the corn maze. And I'm thinking, well, that could be Medicare. I would be calling 911 too at that point. So think of us as the 911 of Medicare if you'd like to do that. Shine volunteers go through 60 hours of training to be certified. So all our counselors are certified. They've gone through 60 hours of training. They take a certification test. They take a recertification test every year as well. We have monthly meetings where we're continually bringing everybody up to date. So it's a big commitment to become a Shine counselor. I'm always recruiting for Shine counselors, and you've met Jeff. I'm sure some of you have seen Jeff. Or go see him if you need help. He's happy to help you. And in my region, which is, as Mary said, out of Mystic Valley Elder Services, we service 21 cities and towns. So we're pretty much north of Boston, up here at North Reading, and then up on the North Shore, Swampscott, Marblehead, Middleton, Danvers, Peabody. So it's quite a varied region, but very interesting, and so we learn a lot because we have a lot of variety and diversity in our region. In the whole state of Massachusetts, there are over 600 Shine counselors. So you can see that it's a pretty good sized program with that. When you meet with a Shine counselor, you can be assured that everything that you say is confidential. That is, we absolutely assure confidentiality. And it's a private appointment. We do these presentations in a group, but when you meet with a Shine counselor, it's a private appointment between you and the Shine counselor. So let's do a little review of Medicare. Medicare Part A. Medicare Part A is something that when you're working, you're paying for it along the way. It comes out of your paycheck, just like Social Security comes out of your paycheck. It used to be bundled just under Social Security, and then they started to separate several years ago. So you pay into Medicare Part A while you're working, you or your spouse. So if you did not work outside of the home, but your spouse did, you're covered under your spouse's Medicare Part A. And as long as you worked 40 quarters under Social Security and your Medicare was taken out, you're not paying a premium when you sign up for Medicare Part A. Typically at age 65 is when most people sign up for Medicare Part A. You could sign up for Medicare if you've been disabled under Social Security disability, for example, for 24 months. On month 25, you would be eligible for Medicare even if you're 32 years old, if you were, were into it through that way. But if you paid into it through your payroll taxes, you don't pay the premium. For those who don't fall into that category, and there are exceptions with cities and municipalities, but just somebody maybe self-employed, I don't know. I met one person a couple of months ago. He was paid under the table his entire life, which was great from a cash flow point of view. But there's a whole other series of problems that go along with that, and that person, when he went up to sign up for Medicare Part A, found out that, oh, he could have it for $450 a month premium. But, so, that's a very rare exception, but it can happen, okay? So that would be the premium if you had to pay for Part A, if you had never paid into the system. Medicare Part A covers you when you're in the hospital or in a skilled nursing facility, not long-term skilled nursing care. Medicare was never, ever, ever designed to take care of us if we're going to be in a nursing home for the rest of our lives. It's really short-term nursing home care. You go into the hospital, maybe you had some surgery, you need a couple of weeks of rehab, you go to a skilled nursing facility, that's what Part A will help pay for, okay? So it's not long-term health care insurance at all. It never was designed to be. Hospice services, Medicare Part A covers that, and home health care services. Again, you're in the hospital, you need the VNA to come to your house for a couple of weeks, a few times a week, or a physical therapist to come to your home for a few times. That would be covered under Part A. Okay? Any questions on that? Then we have Medicare Part B. Things get a little more interesting. You'll see here on the handout, you can follow along with this, that the premium for Part B has, there's several prices here with Part B. The good news is that's going to straighten out in 2012. But let me explain why right now you'll be bumping into friends and neighbors. Yes?
Can you display the page you're talking about?
I'm on page 4 of this, well, mine has got a little pink on it, but it's the presentation. Page 4, Medicare Part B. That is a premium that comes out of your Social Security check. So if somebody asks you what your income is, if they're trying to qualify you for housing or any benefits, they're looking for your gross income. And everybody seems to know what their Social Security check is because it gets deposited hopefully in our checking accounts every month. But that Part B premium comes right off the top. So you always have to add that back in because that is considered income, okay? So right now, as of this moment, there are several premiums out there. Some people are paying $96.40. Some people are paying $110.40, and some people are paying $115.40. The reason for that is there hasn't been a cost of living in Social Security for a couple of years. So anybody who entered Medicare prior to January of 2010, they were fixed at the $96.40 Part B premium. Then somebody joins brand new to Medicare in January of 2010. They started a new rate of $110.50. Again, no cost of living raise for January 2011. So new people joining Medicare in 2011 are paying $115.40. I get my 40 cents and 50 cents as well. But anyway, now I'm sure you heard a couple of weeks ago that there will be an increase in Social Security for 2012. 2012, there will be an increase in Social Security. We just found out a couple of days ago, and it's just, these were already in print, but there is a new premium for Part B. $99.90. Everybody whose income is under $85,000 a year will be paying the same premium, $99.90. I know that's a little bit of an increase for those who have the $96, but it's certainly a decrease for those who have been paying a lot more than that. Now, let's say you're entering Medicare this December, and I'm bumping into a lot of people who are December Medicare, new to Medicare in December. You will be paying the $115 for your December premium. But in January, it's going to go down to $99.90, okay? So the dispute will be over about Part B. I've seen people get into arguments about the Part B premium. You know, oh no, I pay this, oh no, they're right, they're both right, but that's the reason why. So Part B covers you for outpatient services. When you go to the doctor's office, it's Part B that provides coverage for that. Outpatient services, any laboratory work or x-rays. Some of the preventive services. There are more preventive services now covered under Medicare than ever before, and that's a result of the Affordable Care Act. And there's a handout here over on the counter which describes in detail much more of what the preventive services are going forward with Medicare, so that's good news. Medical equipment and supplies, if you needed a wheelchair or a walker, it's Part B that provides coverage for that. Ambulance, an ambulance is probably one of the most disputed issues with coverage with Medicare. Really has to be medically necessary. We run into a lot of clients who will come in to us with their bill in hand from the ambulance company because it didn't get covered. A scenario for that could be, let's say you had to go to the emergency room at 3 in the morning. Chances are an ambulance took you at 3 o'clock in the morning. And 10 o'clock the next morning after you waited a few hours to see your physician, you finally were seen, and then they decided you really are okay and you can go home. That trip home is not covered by Medicare with an ambulance. Even though you may have gone to the hospital with an ambulance, going home means call a cab, a friend, a neighbor, or a relative, but not the ambulance, and that will happen very frequently. So that could be, or the insurance company didn't bill it right. Yes.
So they'll pay for the ride in, but not the ride home?
If it's not medically necessary.
If it's medically necessary?
If it's medically necessary both ways, it would be.
Oh, I see.
If it's,
Okay.
it only covers it if it's medically necessary. Even going from a hospital, being transferred to a to a skilled nursing facility,
Right.
they probably will pay for that, but that patient will be told that there's a possibility that that might not be paid for. And unfortunately, Medicare does not cover chair cars. They only cover ambulances, and it's kind of silly, but I can't speak for the designers of Medicare, but I wish I could. But I mean, that's a case where, yes, it's not, that person can't drive themselves, or maybe a family member can't drive them, but they don't cover chair cars. Maybe someday somebody will realize that that might be the most economical and safer way to get a lot of people. But in the meantime, it's just always ask if that happens. I've seen people from rehab centers go home for a home visit, and the rehab center calls an ambulance. That's not covered, okay? So we need to be aware of those things, because sometimes we're the ones that end up with the bills. So any medically necessary services, Medicare Part B will pay that it's geared to your medical care or services related to diagnosing something for your medical condition. But Medicare Part B only covers 80% of whatever they will cover. So what happens with that other 20%? You don't have to do anything else if you don't want to in terms of insurance coverage. You can leave it alone and take a chance with that 20%. Keep in mind that there's 20% left from that doctor's office visit or anything else we just described. And keep in mind that if you go into the hospital, there's a deductible that it will be $1,156 starting in January. It's $1,132 for this year. It'll be $1,156 starting in January. However, to fill in that gap, what you could get is a Medigap supplement plan. This green sheet that's over there on the counter are all the supplement plans that we carry in Massachusetts. They're private insurance companies, and you pay an additional premium for them. Medix Bronze is one of the ones that's been around forever, but there are 5 other companies out there that provide the exact same coverage. So there's Blue Cross, which is the Medix Bronze, there's Fallon, Harvard Pilgrim, Humana, Tufts, and United Healthcare, which is also the AARP plan. These are all supplement plans. There's 2 types of supplement plans. There's Supplement 1 with a higher premium, and there's Core with a lower premium. The biggest difference between the 2 is that hospital deductible of the $1,156. If you have Core coverage, you still have to pay that deductible. And that's for every time you're admitted to a hospital, as long as there's 60 days in between admissions. So, probably 3 times a year, if you were in and out of the hospital, you would be responsible for that. Supplement 1 will cover that, Core doesn't. In Massachusetts, this is continuous open enrollment for these. So even though right now we're in open enrollment for Medicare, for your Part D drug plans or your Medicare Advantage plans with drugs, with or without drugs, open enrollment is October 15th to December 7th. It's earlier this year. So that's why we're out here talking to everybody too, to remind you about those early dates. But for the supplement plans only, is continuous.